Okay, we want to have roll call.
Mr. Glenn?
Here.
Mr. Coffey?
Here.
Ms. Sonia?
Here.
All right, so we have two board members that's not present today, both are out of town. But we have a 5-member board, and according to our bylaws, if we have at least 3 board members present, then we can have an official meeting. So we have a quorum for a meeting. Okay, the next item on our agenda is the approval of the previous board meeting, which was on May 29th, 2025, the approval of those minutes. The board members have already received a copy of that through email. And if you've reviewed it, then we will entertain a motion to approve.
So moved.
Second.
Okay, it's been moved and second that the May 29th minutes for our board meeting be accepted. So we ask for a roll call on this, Austin.
Mr. Glenn?
Yes.
Ms. Sonia?
Yes.
Mr. Coffey?
Yes. All right, the motion carries. Number 5 on our agenda is public comments. What we're going to allow, anyone that's present at the meeting today will be allowed to give a public comment to any of the items we have on the agenda, on the meeting agenda. The only exception to the agenda would be the executive session. If you want to comment on something in the executive session, we're going to come out of executive session and reconvene the meeting, and then you're able to then make a comment on anything that we talked about in the executive session, as long as it's not nothing that will, take us into the litigations that we are currently in court with. But on any other agenda items, at any time, you can ask to make a comment, and we'll allow you 3 minutes to get up and make a comment on the agenda item. All right, number 6 on our agenda is report of standing committee. Mr. Anthony.
All right. Thank you, Mrs. Vice Chair. Board members, I appreciate you all being here tonight. Staff, as well as community leaders. I stand before you to go over our income statement. You can see our month-to-date for revenue. Net patient revenue was at $829,000. Other operating revenue was at $249,000. Had a net income of $442,000 that we was able to make for the month of May. You can see net operating expenses was at $636,000. Capital related revenue was at $497,000. So overall, another good month on our income statement. Looking over at our balance sheet, current assets sitting right at $24 million. Net patient AR, accounts receivable, is 4.9. Net patient AR is 4.5. Look over with the current assets that's in our fixed assets, 6.6 million. That's bringing our total assets right at 36.4 million. If you remember, we started in August, right at 33.6 million. So we're still continuing to do well. We can still continue to add. Brings in that 442 from our bottom line from the month of May, which brings us down to our 36.4 million on our balance sheet. So strong financial statement for the moment. Looking over our capital analysis on our capital, we totally have $669,000 left from the 1.7 that was approved by our board. We are going to be looking at utilizing roughly another 200,000, and this is going to be due to we have a new CT scan machine that is going to be coming, and we have some electrical work that we have to do to put the new system in, to take the new one out, and have a portable unit on site during that month that we're going to be utilizing the CT. The goal is to not go down on CT coverage for our ER and for our inpatient unit. So we're going to bring in a portable to make sure that we have the care that we need for our community. Looking over on our sales tax, we brought in $219,000 for May 7th, and then we also have another $213,000 that came in on June the 7th. bringing our total to $1.4 million. So we're on target to just exceed our 1.8 that we had from the prior year. And as you can tell, we're slowly starting to see the increase from the new plants and everything that's going on with the new revenue that we have seen on the west side of the river. So we should start seeing some more increase on the sales tax. So I'm happy with that. And all of that is going back into community projects that we're doing, projects to improve the healthcare of West Ascension Parish. When I look over at our budget review, so right now we have $10.4 million in revenue that we was able to bring in year to date. So net patient revenue is at 8.1 million, other operating is at 2.3. So we are $1.3 million ahead of budget where we need to be. So that goes to all the hard work that we are doing with our patients, as well as the investments that we're doing for the community. So I am proud of this 1.3 million that we have, and that's adding to our balance sheet. That's putting us at a stronger foundation for the future and for us to be on a solid foundation of what we want to do and what the board vision is for the next several years here at West Ascension Parish. And at this time, I open up for the Board of Commissioners to ask any questions on the financials.
I just want to add, and everyone in attendance, you do have a copy of the finance statements, the income statement, the balance sheet, and the sales tax report. And we wanted you to have a copy of that because when Shelton is explaining it on the board here, it's not always clear and legible. So we wanted you to have a copy in your hands so you can see exactly what he's talking about. And we will entertain any public comments that you may have on the financial report before we pass a motion to accept it. Any comments from the commissioners? And we'll entertain a motion to accept the financial report.
So moved.
Second.
Okay, it's been moved and second that we accept the finance report. All those in favor signify by saying aye. The motion carries.
Thank you, Mr. Vice Chairman. Now we move into our monthly standing reports. On our social services, total patient visits was 4. A consultation, was 8. Consultation was at 4, and observation was at 1. I did have 2 primary care visits. Also, looking at our NEC, we had our meeting on June the 17th, and everything was approved and accepted. Our QA review, 3 admissions, 18 observations with 3 discharges and 1 death. My wound care patients was at 17. I had 0 specimens that need to be received out of the ER, and my pathologist review was at 0. On our imaging, we had 58 mammograms, 0 on the ultrasound, x-rays was at 120, and our CT was at 90. This clearly shows our patient volumes moving into my ER. We had a total of 468 patients that were seen in the ER. We had our 19 observations. CT scans at 90, total x-rays at 120. We had 1 code. We had 37 transfers and 9 AMAs from the ER. This is going over our nursing documentation. We were at 98% for compliance with 20 charts that was reviewed from our quality team. Also, on our monthly ER test positive rates, I had 20 fluid A and B that was ordered, 0 that was positive. Strep A, I had 20 that was ordered with 1 positive. RSV, we had 6 that was ordered with 0 that was positive. And on my COVID-19, I had 34 that was ordered, and we had 4 that was positive for the month of May. Total ABGs, total was 8. My oxygen hours was flat at 552, and I had BiPAP hours was at 2, 101 EKGs that was performed. Looking over our environment of care plans for the month of May, proud to say everything is where it needs to be and ongoing. Your equipment management plan completes to be ongoing. Your radio test is completed every 3rd Thursday of the month. Our generator load test was completed with a full load that was on May 30th. The safety and risk management plan was completed. We had no activities that need to be addressed at this time. utilities management plan is ongoing. Our line isolation, as well as our medical gas testing was completed. Had our fire prevention plan and our life safety management plan that's ongoing. We did have a drill on May 24th, was completed and successful, and our fire extinguisher inspections were done on the 28th of May. Our oxygen cutoff valves was completed, and we're still waiting on our fire marshal to do her annual review. Also, your ground fault testing was completed, and we have nothing else to report from your hazmat, as well as your red bag and your emergency management. All are continuing to be where they need to be at this time. So on the environment of care, we are where we need to be at this moment. The cybersecurity, we have seen a decrease in the amount of phishing attempts within the organization, which is good. And the amount of quarantine emails have also drastically went down this month. So we are proud of that. On my CEO report, our EMR agreement is in our final stages of being completed at this time, as well as the advisory agreement. We would like to welcome Dr. Tracy Rao. She's our pathologist. She is also joining our medical executive committee. So we was able to bring her on in the month of June. So we're glad to have her on our council. Ascension Parish Sheriff's Office, I'd like to say that they have been wonderful the last several months. They have been doing constant rounding of our facility, which has helped us tremendously on safety. I was named to the Donaldsonville Chamber of Commerce, so I will serve on that board for on representing West Ascension Parish Hospital. Also, our summer health discovery program has been going on for the last 2 weeks, and it's going well. I do have a visitor that's going to be speaking to us in a few moments. And we have completed our van, and our van is posted outside, and we will have some more information at a later date when we're going to be moving that program moving forward. We also completed our annual tabletop drill for emergency preparedness. This was a hurricane that we did. We did a Hurricane Prevost, was a hurricane that was in the Gulf of America. And this hurricane came up as a Category 4 storm, and we made sure that we went over all of our what we have to do and how we need to be on track. So everything went well on that tabletop exercise, and Mr. James Bro was able to get us through that. And our continued focus is on Joint Commission. And I am pleased to announce that we are moving forward. Mr. Richard is moving us forward with that, as well as Ms. Anastasia, making sure that we have the compliance piece where we need to be. So Dr. Lewis and Mr. Gavin, will you please come up?
So we are very pleased. The students are amazing. It's been going really, really well. The students have had the opportunity for these first 2 weeks to go through orientation. They went on their first field trip today. I'm not going to say too much because I have living proof here. So I want to welcome Gavin as one of the students here.
Hello, everyone.
Hello.
So far, I'd say the program has been very insightful. We went through a lot of different stations, I think around 3 so far, 3 or 4. And I think it's a combination of both non-clinical and clinical aspects that we learn, since we get to see the in and outs of how everything works in the hospital. And I've been in IT, registration, and respiratory so far. Being in those, I think that I'm more in the non-clinical side since I like to work with tech. I'm majoring in computer science. But I've learned a lot, not just about like what happens in the hospital and how everything goes around, but also some educational aspects. Like being in IT, I get to see how to make connections with wires, make an Ethernet. And then there was also in registration, we had to label certain things, kind of like packaging almost. But there's a lot of team building inside of the program so far. We were split into our groups, and we got to learn a lot about the different people that are in our groups. It's about 3 to 4 people usually. And so far, I'd say that that's made things a lot more prosperous in the way that we get to learn about each other. But being on the field trip that we went to today, going to LSU was an educational option, and it gave us more insight on what exactly we have as options for college. LSU has a big campus, and having that opportunity for us to be able to go and look at everything, look at the different parts of LSU, what we may be interested in, kind of gave me a boost. I'm going to Southeastern, but I may, once I go for my master's, switch to LSU, just because we took this trip and I got to see how everything works around here. But yeah, it's been nice being in the program so far, getting to see how everything works, speaking with the different staff, learning the ins and outs. I'd say everything is going pretty well right now. It's very educational and also good a good opportunity for everyone, not just people that are going into the nursing field and healthcare, but also for people like me that are looking at stuff like tech and other fields, because it's not just nursing here. It's a wide variety of different things that are within the hospital that keeps everything working together. So we also have our educational days sometimes. We didn't have it this day because we went to the trip, but last time we had it, it was we kind of learned about the different things with certain stations in the hospital, like a more in-depth explanation. At the starts, we have our exercises with breathing to make sure we can get everything calm and relax. But then we have our learning sessions on things. I think last time it was radiology that we looked at, and looking at the X-rays and what types of things go into that. And it's not really my thing since I'm more with tech, but it was still a very insightful thing. And I think a lot of people that were there also felt like it was something that they learned a lot from seeing, because it's not something that we usually get, since it's a new opportunity that people may not be into this thing, but they get to actually see things that they may not have known about, since it's presented to them in that way. And so the educational days that we have and the ones we will have later on, I'm sure will provide a lot of different experiences for all of us that are in the program to see everything and maybe get some new interests among things within the hospital and some things outside of the hospital as well.
Thank you so much.
Gavin,
Vice, Mr. Mayor, Ms.
yes,
y'all have any questions or you want to ask us anything?
I apologize.
I don't have any questions, but just thank you for getting out of your comfort zone and coming out here and doing this thing. Even it's a hospital. You were obviously looking at computers. You said a while, but you're learning that it takes a village to run a hospital in all different ways. So thank you.
Yeah, not only that, I want to thank you too, Gavin, man. You remind me of a very good friend of mine, man. You're definitely a future leader. I'm listening to you. Yeah, I love the way how you understand things, and I hope that you end up with your leadership, because you're going to be leadership. I hope we end up here in Donaldsonville, Louisiana, because that's where we really needed it. But yeah, thank you very much, man. I'm very glad that you explained the program and the benefits of the program.
Yes. It's been an awesome experience, even just today. But the program itself, I think, years to come, it gives so many opportunities. It's just so many insights into the possibilities, and I think this was a great idea. As I looked at the students today, and in the community, in the educational system, but just to give them something else to look into, it's a beautiful thing. Beautiful. So.
Thank you.
These are some wonderful, wonderful students. And I can't thank Dr. Lewis and Kevin, as well as the entire team at the hospital, for taking time out to work with each and every one of the students and getting them out of their comfort zone. And I can tell you, I have not had any disciplinary problems yet, but they all are doing good. These are some really good kids. And I spoke with Kevin about this today. Oftentimes, kids just need a chance, and they just need someone to believe in them and to push them. So the role that our leaders are doing is to push the students and to encourage them to always strive and go for greatness. And that's what they're doing. So Gavin, as well as to all the students, my hat goes off to y'all. Y'all are doing an amazing thing. Thank y'all for everything you do. And thank you for Board of Commissioners for allowing us to put on this program.
Thank y'all,
Thank
that's right,
y'all.
thank y'all, that's right.
Mr. Vice Chairman, this concludes my monthly standing reports. Do you have any questions for me?
Any questions, board member?
I just got one thing to say. I was part of those May statistics this past month. I took a quick visit to the ER, and from when I checked in, registered, to when I walked out the door, I spent an hour or two in there. It's just a wound care that I wanted to make sure it wasn't infected, but I was thoroughly impressed from start to finish, and I just had to say that.
Good. Thank you.
You got anything else?
I just want to say thank you to all of you.
And that's what I want to say. Thank the staff.
Yes.
All right, I mean, you've been making great accomplishments since you've been here. I'm right at about a year and a half now, and great accomplishments. I want to thank you all. We got the transportation bus ready to go. All right, Kevin, thank you. Dr. Lewis, Anastasia here, and everyone else that's on board. Kenneth take care of us on legal. Everybody that's on board, the IT guys take care of everything. Austin takes care of everything, administration. Wednesday's taking care of compliance. I mean, everybody's just working together, man, and we're getting a lot accomplished here. And I'm telling you, I am very, very, very happy about what we've accomplished up to this part. Thank you all.
All right, so we can move to, you have anything on old business?
We don't have anything, so you can, we don't have anything.
Yeah, so, new business.
Yeah, you can move on to new business.
On our new business, we're gonna go over our applications for review and approval. We have our legislative update with Dr. Bugnich. We're gonna go over some department policies and procedures. I have 10 nursing policies and procedures for us to approve tonight. I have 53 dietary policies and procedures for tonight, and we have 119 lab policies and procedures for us to approve tonight. So, Mr. Vice Chairman, I'll stand before you today for three motions. The first will be for full privileges for Dr. Huey Seyfert and Dr. Naheem Okinawa. Both of them are seeking, or with ER hospitalists with Blue Angels, and both are seeking full permanent privileges.
It's been recommended by the committee.
Yes, sir. All have been recommended by ER committee as well quality and medical exec cell.
So moved.
Second.
Okay, so it's been moved and second that we give the temporary privilege to permanent privilege to these positions.
Next, we have is Dr. Evans Rodney, Dr. Darren Bro, Dr. Vinny Serinki, and Dr. Boyd Him, all the way cardiology, Baton Rouge Cardiology Group, and they're all seeking permanent full privileges. Mr. Vice Chairman, they have all been approved through quality, ER, and MedExec.
Make that motion.
Second.
It's been moved and second that we give permanent privilege to these positions.
And the last, Mr. Vice Chairman, is Nurse Practitioner Lana LaBeouf. She is with Wound Care, RestoreX, permanent full privileges. She has been before ER, quality, and MedExec, and we all recommend for her full privileges.
So moved.
All right, so been moving second, and Austin, can we get a roll call?
Mr. Glenn?
Yes.
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 Okay.
Next is our impacts to the 2025 Medicaid cuts on West Ascension Parish Hospital. This is our legislative update. So I'm going to ask Dr. Buggich to come up with us. and explain some of the issues that we are having and what we are facing, and what a potential possibility if these effects will go into effects for us. So Dr. Buggage?
Thank you, Mr. CEO. Good evening, everyone. We have been paying close attention to the news every day. I'm sure you guys have as well. And so the concern right now is the Medicaid and the issues that they're having with Medicaid and how it affects our rural hospital systems. At this point, there's to be a vote by Saturday, I understand from my research. And we have been speaking, strategizing, and making sure that we keep in touch with or keep familiar with what's happening in our two senators' office, Senator Kennedy and Senator Cassidy, as well as whatever member of Congress that has this area we've been in conversation with as well. So we'll continue to, as the board has asked us to do and the chairman has assigned us to do, to continue to keep in touch with the legislators that are the federal legislators, and as well speak with the local ones to see how and what they can do to assist to make sure our position and concerns are being heard. At the end of the day, you'll see some of the impact that it will have. I won't read these to you, but I'll share with you that it can affect the West Ascension Parish Hospital District by a $500,000 hit in the budget. $500,000 is nothing to sneeze about. So we are keeping vigilant to make sure that we share with you all. If you have ideas or anything that you'd like to share with us to make sure that we bring it forward to be known by Senator Cassidy and Kennedy and Representative Troy Carter, and let us know, and we are doing our best to make sure that we are in touch. And we are planning to do a letter. We know that the vote is coming up, but we still want to have a letter in the hands of our senators on what the effect will be for Prevost and continue to urge them to do what we need them to do, which is fight for the positive side for us. That pretty much concludes.
Because basically, we are 36% Medicare, 37% Medicaid. So almost 70% of our business is Medicare, Medicaid. When you're thinking about a $500,000 cut to my bottom line on my cost report, that looks at jobs, that looks at programs that I can be able to do for our community. It looks at what I'm gonna do for my wound care or extending hours. So we are already planning for that $500,000 cut. And actually, as we're working on our draft budget, we are looking at what $750,000 would be away from our bottom line. So I tasked our leaders to go back to their departments when they started working on their draft budgets. And I let them know, look, this is what I want you to look at. They was able to give me what they're expecting and their capital. And I worked tirelessly to look at our draft budget and to see where I can cut and where we can make strides at. Because what I don't want to do is I don't want to have to cut anything. Our passion, what we do here is so important for our community. However, we all know that, yes, Medicare and Medicaid, there can be some twerks, there can be some changes. We know that. But to cut drastically is not where we want to be at. However, we will go with whatever comes about, and we know how to overcome, and we will overcome. So I just urge each and every one of you all to just continue to work with me. And as we continue to go through this part of this season, and we will get to a better understanding.
I want to ask Dr. Buggage. The Senate is going to vote on this, you said, by Saturday. The House has already voted on this big so-called beautiful bill. By one vote, they passed the proposal, the budget proposal. And now the Senate is going to vote on it. What does it look like? How does it look like the Senate is going to vote on this thing?
Well, I can share with you all that as I've been researching today, every news outlet that I've been looking at, whether it was USA Today or NPR or the New York Times, it's saying that um, the bill will go with some tweaks. There will be some tweaks, but they will run it through on Saturday because the White House has been asking them because they want to have something by the 4th of July. So it just means that we have to just keep at, if you can call your members today, there should be a phone number on our presentation. If you can encourage your colleagues and family members and everybody and anybody who listen to give that 202 number a call so that they can, regardless to what some of the things I've read, which that we know it's already done. We know it may be already done, but it may not be already done. There may be some things and there may be some changes, some resources that people may say, okay, we can look and get this from here. But I will tell you, Mr. Vice Chairman and board, committees and staff, that the CEO has been, and Ms. Anastasia, we've been talking, and we are in the process of looking at some other options, like what can we do with USDA rural? What can we do with Interior, Department of Interior? There's monies that we made, now that we have this program with the young man who is an amazing representative of the city of Donaldsonville and West Ascension Parish Hospital District. Thank you for what you're doing. And there may be other options, other committees, other grants that we can get. But at this time, it seems that, I don't want to say a foregone conclusion, but that's what I'm reading.
Even the little tweaks that you possibly speak of, will that help a little? You're saying it may be little tweaks here and there,
I don't know. I haven't spoken with Senator Cassidy's office, but I looked at a piece that he did on yesterday, that he said that there were some things that he knew that he wanted to share with them that would be some of the changes. With him having the experiences that he has with Earl K. Long Hospital, I think whatever information he shares with them will be monumental in bringing it into the right direction. I think, of course, because he is a representative of the state of Louisiana and understanding and knowing where we stand and so many of the metrics, that it would behoove all of us to make sure that it's something that would be positive for the rural communities and the hospitals. But it's all at the last minute. It's going to be, that 9th, 11th hour kind of thing. Probably they'll be in there at 4 o'clock in the morning voting. So when we wake up the next day, we'll know what's what. But anything is, you just go back and keep at it until you can get it right, is what my opinion is. And that's how we're going to go at it strategically with the team here.
Thank you.
I think.
Right. So now it goes over to some of our policies that we have. Our nursing service policies, commissioners, have all been through quality, ER, and MedExec, and we've reviewed all with our consultant, Ms. Crystal Mitchell, and our chief nursing officer, Ms. Anastasia. I do bring before the board to approve the nursing services policies and procedures as presented on the recommendations from quality, ER, and MEC.
So moved.
Okay, so we have a motion and a second to approve the dietary policy. That's what we're talking about now, the dietary policy and procedures.
no, the nurse.
Nursing policy.
Nursing, okay. Oh, here we go. All right, so we have a motion and a second to approve the nurses service policy and procedure. Well, we'd like to get a roll call on that. Yes.
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 Next, Board of Commissioners, I bring before you our 53 dietary policies and procedures. These policies and procedures have been reviewed by Mr. Causey, who is our senior leader for that department, as well as their direct senior leader, which is Mr. James Bro, and the dietary manager, Ms. Evangeline, as well as our consultant, Mr. Jerry Lorman. These policies have been brought before quality as well as MEC as presented for final approval from the Board of Commissioners.
So moved.
Second.
Second, okay, and we don't need a roll call on this particular item, so we can move to the next one.
The last is our 119 policies. These are our lab services policies and procedures. These policies and procedures have been reviewed by Dr. Tracy Rao, our pathologist, Mr. Chase Walker, our lab manager, as well as our consultant, has moved up to Ms. Alicia, who is the direct senior leader, and Ms. Anastasia, which is our chief nursing officer. These policies have been before ER committee and MedExec, and we move that our policies and procedures are presented as followed and be adopted for final resolution with the board.
So moved.
Second.
The motion carries.
Thank you. And Mr. Vice Chairman, this concludes my new business for today.
We're about to break a record here. All right, so look, everybody, what we're gonna do, we're gonna close the regular meeting and go into executive session. So I entertain a motion to go into executive session.
Any public comment on any of the executive session agenda items will be reserved for after executive session.
Okay, so,
So I'll make that motion to enter executive session.
all right, so we moved in second and we're about to go into executive session. When we come back out of executive session, if you can stay around, you can leave, but if you want to comment, as Falcon said, on any of these issues here, you're welcome to do so.
And need a roll call.
Need a roll call? Okay, there we go. Roll call to go into executive session. Yes.
Yes.
Okay, We're now back into
Roll
our
call.
regular, roll call. Roll call.
Mr. Flynn,
Yes.
Mr. Falcon,
Yes.
Ms. Simon.
Yes.
All right, so we're now back into the regular meeting. As a result of our executive session, we will entertain a motion. Okay, so if there's any public comments on this first motion that we're about to entertain here, it's on the Epic contract with Our Lady of the Lake Hospital. Are there any public comments and would like to get up and give a public comment on this particular contract?
Seeing none, I'll make a motion to authorize Mr. Anthony for signature on the Epic Community Connect Services contract.
Second.
All right, it's been moved and second, so that motion carries. The other item we have here is to give Sheldon the authorization to sign the advisory contract with Our Lady of the Lake Hospital. Are there any public comments on that particular item? All right, hearing none, we'll entertain the motion.
To accept that Shelton signs the advisory contract for Our Lady of the Lake.
Second.
Okay, it's been moved and second, that motion carries. Third item we have here is a resolution from the board. Resolution not authorizing an increase in the available funds for the construction for Project 1705 with the Chevans contract. Are there any public comments on that particular item? All right, hearing none, we'll entertain the motion.
I'll make a motion to adopt the resolution.
Second.
Okay, we have a motion and a second to adopt the resolution. So done.
And I will move to adjourn.
Second that.
The meeting is adjourned.
All right.